The Ghana Health Service says it has formulated an appropriate response plan to deal with the surge in COVID-19 case count in Obuasi. Director General Dr. Patrick Abuaji, who is leading a team of experts in the mining town, tells my colleague Ohiming Teria the response team is equipped with an appropriate plan after several meetings with stakeholders, including officials of the two assemblies, health personnel, and opinion leaders. The Obuasi and Obuasi East assemblies have recorded about 70% of the total number of coronavirus cases in the Ashanti region. The response comes with reinforcement of the medical staff as two adjoining districts, Adansi North and Adansi Asonkwa, volunteer personnel to help speed up contact tracing. Ohiming Teria is on the ground in Obuasi right now and joins me with the very latest. Ohiming, what more can you report, or what has been happening today? All right, before then, let's listen to this soundbite.
To work with a team in the district to look at, first assess the situation and then help them draft an appropriate response, which they're already doing. So we met opinion leaders, we met the MCE, and we met the health team, and we have finished our plan and see how we can quickly control the situation in Obuasi.
Right, and Ohiming is on the line now with us. So, Ohiming, what more do you have to add to what the Director General of the Ghana Health Service has been saying?
Thank you, Israel. Today, it was a marathon meeting, series of meetings for the Ghana Health Service, a team from Accra, led by Dr. Patrick Abuaji, and then Director of Surveillance at the Ghana Health Service, Dr. Franklin Asiedu Bekwin. First, they met with the medical team working on the COVID-19 in the Obuasi enclave for Obuasi Municipal Assembly and then Obuasi East District Assemblies. After that, they also met with the two district chief executives, Elijah Adansibona for Obuasi Municipal and Faustina Amisa of the Obuasi East District Assemblies, and also with opinion leaders, where they discussed the possible plan to deal with the spread of COVID-19 in the Obuasi. For the past weeks, Obuasi has seen an upsurge in COVID-19 cases from the one that was recorded about 2 months ago to 511. That's the latest figures I am picking up here. If you compare the figures, then it means that Obuasi alone is contributing not less than 70% of the Ashanti regional figures. The Ashanti Regional Health Directorate is supporting the efforts to control the surge in COVID-19 cases in Obuasi. The Regional Health Directorate has already contributed 20 personnel, medical personnel, to support the already active team in Obuasi. And then the Ghana Health Service, the national headquarters, also comes in with personnel to assist. Just as the meeting was closing, then we learned that the two adjoining districts, Adansi Asokwa and then Adansi North, are also contributing medical personnel to support the contact tracing activities of Obuasi. This comes as a sign of relief, especially to residents of Obuasi. Some who are, though there are still mixed feelings, some believe that the COVID-19 is not prevalent in Obuasi. There are others who are of thought that yes, the condition or the disease is real. So it comes as a relief for the entire enclave of Obuasi. It also comes at the time that the Municipal Assembly opened up the Obuasi Central Market for the very first time 1 week after its closure. The Obuasi Central Markets A and B contributes not less than 1,500 traders. And today the Assembly says it's opened the market on shift basis. Only 500 traders were allowed into the market. And tomorrow another set of traders, 500, will also be allowed. And then the next day, another 500 will also come back to trade at the market facility, Israel.
Now, Ohiming, one question I want to ask you is, do we know, or the health authorities, have the health authorities been able to establish why Obuasi is accounting for so many of the cases?
they are mentioning a lot of factors. First, they believe the active surveillance measures that they have introduced in Obuasi is also a cause to this. They said that they are doing more testing. Obuasi alone, if you look at the original figures of over 41,000 plus samples collected over the period, Obuasi alone, as at the last time I checked, has collected 4,900 samples. So it means that the more tests they conduct, or the more samples that they collect from the people, the more positive cases the area records. And then they are also talking about a lack of public support, public apathy, and the fact that there's this misconception about the public that the COVID-19 is not prevalent. At the time that, parts of Ghana, Ashanti, and then Greater Accra were under lockdown, there were high expectations that Obuasi probably would have been locked down. But that is when officials say people were adhering to social distancing protocol. But when the lockdown measures did not affect Obuasi, then the people relaxed to the extent that when you go to the market, the central markets A and B, the place was crowded. People were lumped up in the facility, forcing authorities to close down the facility. And then on the streets of Obuasi, the people were reluctant to put on their nose masks at the time that the presidency has announced this mandatory wearing of nose masks. And every district assembly was enforcing this particular protocol. But in Obuasi, the story was different. So the authorities believe that all these are contributing factors to the reaction or the spread in COVID-19 in Obuasi.
All right, thank you very much, Ohiming, to bringing us that update, the live update from Obuasi. Back to you.